Facelift, neck lift, lip lift, and lower blepharoplasty. Shall I do it at the same time or separately? I am interested in all of the above, but can't decide whether to do it all at once or separately. Altogether, it will require 6 hours of surgery. Would I be under for all that time? Is that dangerous? Is the trauma to the face too much and likely to lead to complications? I am a 47-year-old female. My friends say, "You look great, you don't need it." I've already decided to go ahead with all the procedures. It's just that the pushback is causing me to be more concerned. I appreciate your feedback.
Thank you for your question. You're 47 years old and you're contemplating having surgery that will involve a facelift, neck lift, lip lift, lower blepharoplasty. And the anticipated time of the surgery will be approximately 6 hours. And you're stating in your question that you're concerned about the safety of being, quote, under, or whether or not you will be under for that length of time, and that you're getting some, quote, pushback from your friends saying that you look fine. And so basically the question is it better to do everything at once or to do them separately? Well, I can certainly give you some guidance from my perspective as a practicing doctor. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and all those procedures you listed are a big part of my practice, and certainly I have a lot of experience and opinion about safety and the question of relative risk when it comes to cosmetic surgery. Now, this is my opinion. It's a personal bias, and it is not in any way necessarily indicative of any disparaging of other doctors who do things differently. So, as far as first, let's go with the subjective concern of being a 47-year-old woman and having these procedures. I think that in addition to your friends, if you go visit 5 more doctors, 10 more doctors, you are going to get many, many opinions, and you will get everyone's perspective on what you need. So ultimately, there's always going to be a question in your mind of whether or not this is the right time to do the procedures. But the key is really, what is the desired outcome, and will you get the desired outcome with the approach that's being recommended by your doctor? So the first question is, will you be under for that long? Well, that's a question that you have to ask your doctor. You know, if I anticipate doing any surgery, well, I always give an estimation of the time of the preparation, the time of the surgery, the time of the recovery. However, I would say to you that I really, for my practice, I don't do any general anesthesia. The exception would be for a rhinoplasty operation where there's an issue with the airway, and that really does require general anesthesia. But otherwise, for the procedures that you're contemplating, it is routine for me to do everything under local anesthesia with light sedation. The reason I do that is a couple of reasons. One is, of course, relative safety. In my experience and from my perspective, local anesthesia with light sedation is considerably safer than general anesthesia. The patients are able to avoid a lot of the medical stressors of being under general anesthesia. Their recovery is a lot easier. My patients routinely walk out of the office feeling good. They have their little face wrap after a facelift, and they're smiling, and they're thanking my staff, and they're saying goodbye, and it's fine. It's very much in contrast to the way I learned facelifts in my training back in the early to mid-90s when I trained. We put everybody under general anesthesia. We put drains. We put a large wrap. We kept people overnight in a hospital or surgery center for an overnight stay. So, and that still is a valid approach. So, but from my perspective, I think that local anesthesia with light sedation makes my life and the patient's life a lot easier. So that's one bias right there, and there's one difference in my approach. As far as doing all those procedures together, from my perspective, that's not a problem. It is not unusual in our practice to do a brow lift, upper and lower eyelid blepharoplasty, facelift, neck lift, and doing it all together. So it's not the multiple procedures per se. It's really about the time. I feel that with local anesthetic and light sedation procedures, I try to keep the procedures less than 4 hours. And certainly in my hands and the type of procedures I do, I try to, that's kind of where I draw a line. And it's not so much the names of the procedures, because even a facelift, face and neck lift can be a short scar lift, it could be a moderate facelift, or it could be an extended face and neck lift. Eyelid surgery can be limited, it can be more involved, it could be a lot of additional procedures such as ptosis, canthoplasty, lateral tarsal strip, laser. I mean, certainly any focal area in the face can take up much more time when we're dealing with a specialist approach to any problem. So as far as the range is concerned of time, it's gonna vary. And last but not least, of course, I would say that at 47 years old, the photos you submitted, I can't see everything, and without a physical exam, when I examine a patient to determine if they're a good candidate for facelift, I'll actually lift the skin up and show them what they can have done. In our practice, we can offer a lot of limited procedures where, okay, they can have their eyelids done, and we can do something like structural volumizing to improve the volume in the cheekbones and the jawline for somebody in your age range, and it can make a difference that can be comparable to a facelift. So the possible options you have are probably, you can certainly consider if you are getting a little bit of cold feet or anxiety about having the surgery. You can learn more about your options, visit other doctors, and just get a kind of a balanced perspective. If you've chosen a doctor and you feel like you trust this doctor, then this is a discussion to have with the doctor and decide what your priorities are. Sometimes patients will say to me, well, maybe this year I'll just do my eyes. And because I don't do general anesthesia, that's an easy decision, because it's not like I'm going to say to them that you're going to have general anesthesia, you might as well get everything done together. In my practice, I can do their eyes, we can do their face later, we can do injectables, we can do a lot of things. So there's a lot of flexibility in the approach that I have, which corresponds with the realities of the modern lifestyle for a lot of my patients. Basically, people are short on time. So we have to work with the realities of people's lives and work within those parameters to get them the best results they can. Sometimes there are some hard deadlines like weddings and graduations and birthdays, and so all kinds of things that have to be factored in, as not to mention busy personal lives, busy professional lives. So discuss all these questions with your doctor and maybe get some additional opinions just to give you some perspective and see if there's some consistency. And if there are some inconsistencies, address these with your doctor. I think that it's become my observation, and at least my style, to be not just the surgeon who can technically treat an individual's concerns, but also to be like their primary care doctor for beauty, so I can be their guide in all the things that they are concerned about. In our practice, we offer everything from skin products to lasers to advanced cosmetic surgical procedures. So there's not a limitation in the possible solutions, but rather a customization in what can best serve the needs of the person who is looking to improve their appearance. So I hope that was helpful. I wish you the best of luck, and thank you for your question.